We've learned so much over the last year about the wide-ranging effects of COVID, right? But one problem that hasn't really gotten a whole lot of attention, the serious effect COVID can have on the health of your mouth. Everything from sensitive gums to teeth actually falling out. When we come back, we'll speak with a dentist as well as a patient who has suffered severe dental problems after getting COVID. There's a huge correlation between our physical health and our dental health. So it's not really surprising that people who have recovered from the coronavirus are now sharing stories of how their teeth or their gums weakened, or that their teeth became discolored, broke off, or even fell out. A recent study also found that having gum disease may actually raise your chances of needing to be hospitalized and perhaps even death in COVID-19 patients. This is why good oral care is so important during the COVID-19 pandemic. Joining us now, Beverly Hills periodontist Dr. Rashti, along with her patient, Chris Hood-Eye, whose dental health suffered from recovering from COVID. First of all, Chris, you feeling good? You feeling healthy?
Yeah, much better. Much better now.
I'm so glad. Great smile. We'll talk about that in a second, but let's talk to Dr. Rashti. I want to talk about both of these things. The gum disease. If you are a person that has gum disease, it increases your chances of hospitalization or even death from COVID?
Unfortunately, that's true, Michaela. You know, gum disease is an inflammatory disease.
Sure.
So does the COVID-19. So there are reports of like 9% higher risk of dying from COVID-19 if you have gum disease. There are reports of like 4.5% increase likelihood of needing a ventilator if you have gum disease, and also 3.5% increased risk of being admitted to ICU as a result of gum disease and COVID-19.
Goodness. Okay, now the other part we want to talk about is that if you've had COVID and you're a survivor of it, that there is some of these dental health issues like Christopher. What kind of things are you seeing that has affected people's teeth and gums?
There is a significant increase in the number of people who are recovering from COVID-19, and then now they are suffering from dental issues such as chipped teeth, grinding, broken teeth. And one other thing that is like interesting is that people who are recovering from COVID, they're actually losing their teeth without any significant sign of bleeding or pain. In fact, I just saw a patient last week who lost one of his back tooth 2 months after recovering from COVID.
Goodness.
What was unique about it is that he did report no bleeding, no pain, nothing.
Is more data needed on what the cause is exactly, or is this sort of just anecdotal evidence that we've been seeing?
Right now, it's just like reports from dentists. I mean, obviously, COVID is something new, and we need more of the research and long-term research. But is that what American Dental Association reports of like dentists? 70% of dentists reporting 60% increase patients complaining of grinding or chipped teeth or pains associated with the jaw or the movement of their jaw, facial muscle, postural pain.
Christopher, I want to bring you in. You look great, hale and hearty now with a great smile, but it wasn't always the case after getting COVID. What did you find happened with your teeth?
So, like, I had a very mild case of COVID, didn't really ever develop a fever, so I anticipated that my recovery would be much better and I would be fine. And probably a couple of weeks after, I started to notice bleeding in my gums, and then constant teeth grinding during the day, grinding during the afternoon, just all day. I couldn't stop it. And then, as you can see in the pictures, I looked at my teeth and I was like, what happened? Where did the white teeth go? So those were the first things I started to notice. And I had to get a mouth guard to wear during the day now. I'm wearing throughout the day to help prevent me from grinding my teeth because I don't want chipped and cracked teeth.
No, right, and you're a smiley guy. You want to show off those pearly whites. So the mouth guard was a great solution. Dr. Rashti, what other things can you suggest to patients just like Christopher? Because I imagine it's going to present a little differently in each patient. You sent some tips along. You say even checking our posture can help?
Absolutely. As you know, most people are working at home in front of computer for 7-8 hours a day, and they are unaware of their posture. They are unaware of like sitting the same position all day. So it's better to, make sure you don't slouch in front of the computer. If you can get up every 5-10 minutes or even half an hour, walk around, move your jaw around a little. Don't be aware of your surrounding.
Yeah.
Make sure your dentist, if you can, have a custom-made guard. And Botox is another
Botox, how
way
about
to
that?
prevent that.
And Christopher, the mouth guard, does it get in the way of life, or is it working out okay for you?
Yeah, I mean, it's not the most comfortable thing to be wearing throughout the day. So it's definitely a little inconvenient, but I'd rather have a mouth guard than chipped teeth.
Honey, isn't that the truth? Isn't that the truth? Well, look, we are really pleased to hear that there is hope for you and that you have already got some results from the mouth guard. You probably saw it. Just for folks at home, there's an increase in grinding and clenching. There's an increase in chipped and cracked teeth, and you might even see some jaw pain and compromised jaw movement. So if you see that, be sure to check with a dentist. And that's the other thing, Dr. Rashti, we want to remind people, it's safe to go to the dentist. Make sure you keep up with those dental, Chris is nodding. Make sure to keep up with those dental appointments. Dr. Rashti, Christopher, thank you so much for having this conversation about COVID and dental care today.
Thank you for having us.
Thank you so much.
I love it. You have a great day and stay safe, both of you. I can see why Christopher was worried. He's got a beautiful smile, Maria.
Beautiful, absolutely. And you've just reminded me to follow up on my dental appointment.
Yeah.
Me and my little one, Gus.